The Department of Health has paused commencing provisions of the Assisted Human Reproduction Bill, which was introduced last year, which concerned surrogacy provisions, specifically international surrogacy. This was something that Helen McEntee and Stephen Donnelly, when they were Ministers of Justice and Minister of Health, welcomed when they were the first country to kind of introduce this scheme, which would pre-authorise Irish couples getting international surrogacy arrangements, whether it be in countries like Ukraine or Eastern Europe or other parts of the world. The Sunday Independent has learned that there are now concerns in the Department of Health and the Department of Justice that the provisions of the surrogacy parts of the bill will breach EU laws preventing human trafficking. The international market for surrogacy is expected to grow to 129 billion by 2032. There are concerns at EU level and in the Department of Justice that the Irish law would actually thwart other countries' attempts to clamp down on international surrogacy. There have been examples in Ukraine and in Greece in recent years where women have been found to have been trafficked to those countries to give birth to children who are born through surrogacy arrangements with the intended parents coming from Western European countries or America. So there is increasing concern that there are trafficking groups getting involved with IVF clinics in these countries, and that this is a new and growing form of human trafficking. This is something that the EU is looking to clamp down on and has brought in a specific directive to clamp down on this in 2024. At the same time, Ireland introduced these groundbreaking laws to allow and pre-authorise international surrogacy. This is something that the Irish Human Rights and Equality Commission warned the Department of Health about in April 2024. It said it had concerns that the laws that Ireland had planned to introduce would actually breach and counter international efforts to thwart human trafficking. The Irish Human Rights and Equality Commission said that the light touch regulations have the potential to increase the risk of exploitation of surrogates and the sale of children. They may also inadvertently put Irish courts in the position of having to give a stamp of approval to dubious and exploitative arrangements in other countries. The Department of Health confirmed to the Sunday Independent that it has paused implementing any of those surrogacy provisions while it is getting expert advice from the Attorney General, the Department of Children and the Department of Justice. The Department of Justice said it is working closely with the Department of Health to ensure sufficient safeguards to protect the rights of surrogate mothers, including from the threat of human trafficking, and they continue to engage with the Department of Health on this matter. When the Assisted Human Reproduction Bill was introduced last year, it was a huge bill which introduces regulation of fertility clinics and all sorts of other fertility products and fertility treatments. The surrogacy part of the bill was one important part of it, which many said should have been its own act because of the complexity of the law there. It was welcomed by many campaigners, including Mary Siri Carney, a Fine Gael senator at the time, and there would be a lot of disappointment by people involved in surrogacy and those looking to expand their families through surrogacy that the provisions that were welcomed and lauded at the time have been suspended, and there is no commitment at the moment from the government as to when those surrogacy provisions will actually be enacted to legalise and regulise the situation that so many of these families find themselves in.